education at Caledonian University. Currently, he is also adjunct assistant professor, associate professor of Edith Cowan University in Perth, Australia. His role at Glasgow Caledonian University has a focus on international development, international recruitment, international student support, transnational educational project, international continual professional development, and summer school provisions. And regarding the clinical research expertise, he has a background in the clinical research, starting his first clinical research nurse post in 1994. And 2 years after, he was applied as the associate nurse manager in the clinical research facility in Edinburgh. During his time at the CRF, he developed an interest in the education and training of clinical research professional, and upon moving to higher education in 2006, he established courses in clinical research. The program he led included undergraduate and postgraduate qualification in the UK and Master of Science in Clinical Research in Singapore. He also established the Scottish Research Nurse and Coordinator Network in 2005 and remained an expert in this field. And do you know Viking? Viking? He is from the Edinburgh. Still remember Harry Potter? Yeah, he is the father. Okay, because everyone already joined and we have limited time. So we have almost 50 minutes for your lecture, and last 10 minutes, we will have like question answer session. Okay. Oh, okay, no problem. Okay, no problem. You can manage the time. Okay, you can start your session, please. And we also rely on Zoom meetings, so some students also join through Zoom.
Okay.
Thank you very much.
Marvelous. Thank you very much, Titus. Good morning, everyone. So first of all, I really want to say I'm so honored to speak to you all today. And many thanks for the invitation from Dr. Hannah for me to speak today about research and education in the UK and in Europe. As Tita says, my name is Dr. Gordon Hill, and I am the international lead within the Department of Nursing and Community Health at Glasgow Caledonian University. I'm proud to be a nurse, and I know that it is International Nurses Day on Monday. And I don't know if you can see, but I'm wearing a special tie today. In Scotland, you may have seen some Scottish films where men wear kilts, wear skirts. We don't call them skirts, but we call them kilts. And each family would have their own tartan. So this is a nursing tartan that has been developed, and it's made up from all the colours of the nurses' uniforms that we use in Scotland. Oh, excellent, thank you. So yes, I'm very proud to be a nurse, and I'm very proud to be here today representing nursing, and I'm so honoured to be speaking to you all today. I'm visiting Indonesia as part of a British Council grant that Glasgow Caledonian University and the Faculty of Psychology at UNPAD received to establish an international psychology programme, and I'm delighted to be able to speak to you here today as part of the visit. I hope today will give you some examples of how we engaged in research in the UK and in Europe, and give you some ideas about perhaps your own career in research. Next slide, please. Change here as well. Okay, so before we start, just a bit about me. As I said, I'm the international lead. I should say, I'll try to speak very slowly, but if I'm speaking too quickly, or if I'm saying, Scottish people use some Scottish words. So if I use some Scottish words by mistake, please let me know. And if you need me to slow down, please raise your hand and say, please, Gordon, please slow down. So I am the international lead in the Department of Nursing and Community Health. I'm also on the steering committee for the Royal College of Nursing Research Society. And I work with Professor Bridget Johnson, who was Dr. Hannah's supervisor in Glasgow. So that was a happy coincidence as well. As Tita said, I have a background in clinical research nursing. So that is, these are nurses who work on clinical trials and assist in multidisciplinary research. So I did that for too many years. I don't want to tell you because it'll tell you how old I am. Um, I'm also the director of the WHO Collaborating Centre for Nursing and Multidisciplinary Rehabilitation at GCU. And I'm very pleased to say that we were redesignated as a WHO collaborating centre last October for another 4 years. And we're so honoured to be able to assist the WHO in the work that they do. I'm also on the editorial board for the Journal of Research in Nursing. So if you want to publish any nursing research, then please submit your manuscripts to the journal and we'd be delighted to receive them. Next slide, please. I won't go into too much detail about the research I've done, but I'll just say a bit about some of the research that I'm involved in at the moment. We are really keen to develop collaborative online international learning projects at GCU to help students who perhaps wouldn't be able to access study abroad to have an international experience. So we have, for a number of years, we've had a project with University West in Trollhättan in Sweden with the community nurses there. So we're undertaking a research project about the nurses' experiences in Sweden and in Glasgow of participating in these types of online events. I'm also involved in a cross-European piece of research in cultural competence in undergraduate nursing students. And GCU is the only university in the UK that's involved in that. I've recently started a project. As I said, my background is in clinical research nursing, and clinical research nurses really began to be recognised more in the UK in the 1980s, but their experiences have never been captured. And as you can imagine, nurses who were working in the 1980s are now themselves in their own 70 or 80s. So we want to capture their experiences as almost like a historical artifact to be able to say what nursing and clinical research was like then. So we'll be starting that soon. I'm also a very keen podcaster. Sorry, very keen podcaster. So I'm going to do some research into how podcasts can help to enhance nurse education, specifically in modules relating to research and evidence-based practice. And I'm also involved with the WHO and a publication examining nursing educational developments in Europe, mainly looking at the transition from diploma level qualifications to bachelor's level and the impact that the graduate level nurses had on nursing care around Europe. And that's again a bit of a historical kind of reflection on that, but it's also to help to inform some of the countries in Eastern Europe and in Central Asia that the WHO Europe region work with to show the benefits of a graduate level education, which I'm sure I do not need to say to you because you're all highly educated nurses. Next slide, thanks. So I thought I'd tell you a bit about the Department of Nursing and Community Health at GCU. The department brings together academics and clinical staff from a variety of different areas. I'll say about the courses in a minute. Sorry, next slide, thanks, thank you. The ethos of the department is improving lives and all our activities are aimed towards that. The overall ethos of Glasgow Caledonian University is for the common good. So we do a lot to engage with the community in Glasgow. A large number of our students come from deprived backgrounds. A lot of the nurses who study at GCU still go to college first and they do a diploma there and then they can come into the programme a bit later. So we really are very keen to make sure as many people as possible who would like to be a nurse are able to access education. Next slide, please. Undergraduate nurse education in the UK is a little bit different from almost everywhere else in the world, in that for our undergraduate nursing programs are split into 4 different fields of practice. So right from the start of the program, you register as being an adult nurse, a mental health nurse, a learning disability nurse, or a child nurse. So you would register as one of those in one of those fields of practice, and the reason for that was that, especially in the fields of learning disabilities, or you may call them intellectual disabilities, and mental health, there were not enough nurses with the specific training that was required to work in these areas. So the Nursing and Midwifery Council, the regulatory body in the UK, decided to split into 4 fields of practice. I think everywhere else really has a generic nursing program, and then you would specialise afterwards. So the UK is quite different in that respect. We also have a professional studies and nursing program, which is really a CPD, a continual professional development course, but also allows nurses who have a diploma to do modules, to do courses to be able to attain a bachelor's degree. Our Masters in Nursing is advancing professional practice, and a lot of advanced practice nursing in the UK now also includes things like prescribing medication and physical examination. So the course includes programs on these things as well. We also have an MSc pre-registration nursing. So this is for people who already have a bachelor's degree in a different topic, but would like to become a nurse. So rather than doing another bachelor's program, what they can do is a master's level qualification, and then but still get registered as a nurse at the end of the program. So it's a very intensive course. Our normal undergraduate program for a bachelor's degree is 3 years, and for the honours is 4 years. So an honours level is between bachelor's and master's level. But the MEC pre-registration nursing is just 2 years in 1 semester. So it's very, very concentrated. So it means it's quicker for graduates already. We have a lot of community nursing programs in the UK. We have district nurses who help people, adults in the community, and we also have health visitors who work with mothers and children from about 6 months to 5 years old. So we have programs for those students, and those are the nurses that we have the collaboration with Sweden with for the online learning. And we also have a very successful Master of Public Health program. Just before we go on, I'm going to play a video later. Will it have sound for the room? Yeah. Okay. We in at GCU in the School of Health and Life Sciences, the research programs are all multidisciplinary. So it's not just nurses, it's not just physiotherapists. All the groups all the professions work together, and these are the research groups. And I've included a QR code there so you can find out more about the research at GCU. So if any of you are involved in research and would like to connect with people at GCU, then you can either contact me or you could contact the people in the departments. But as I say, these areas are all multidisciplinary, and that's part of the reason that we also changed the WHO Collaborating Centre to multidisciplinary rehabilitation, because interprofessional education and rehabilitation is a real strength at GCU. So, next slide, please. So the purpose of this session is to explore the journey, impact and future of nurse-led research in Scotland, in UK and also in the wider Europe. So I'll draw some examples, I'll tell you about the development of nurse-led research in these countries, and hopefully you'll gain some inspiration for your own careers in research. So research led by nurses and the contributions that they make as members of the multidisciplinary team can drive change. Evidence from research influences and shapes nursing profession and informs and underpins policy, professional decision-making, and nursing actions. It is the cornerstone of high-quality evidence-based nursing, and it really, really is crucial. Subsequently, nurse-led research empowers nurses to directly influence practice, policy, and very importantly, patient care. And the field is increasingly seen as essential for healthcare innovation. If I think about my own career in research, the recognition and the importance of nurse-led research is unrecognizable from when I started to where I am now. And I think it's as you as student nurses, and you have the power to take it on to the next level as well. So hopefully you'll be thinking about a career in research or incorporating research into your clinical practice. And I hope that today will help to kind of encourage you to do so. So hopefully you know who this lady is. On Monday, I think it's her birthday that we're celebrating for International Nurses Day. So Florence Nightingale was a real pioneer for data-driven approach to care. And I have to say, probably embarrassing some of her medical colleagues at the time, which I think was quite nice. But following that, there have been in the 20th century, there have been limitations in research roles for nurses. However, some important point was Nursing Research Journal was first published in the 1950s. And I think that was a real important point in terms of being able to provide an evidence base for nursing. And then in the 1980s, evidence-based medicine rises in importance and evidence-based nursing follows on from that. So in the UK, what were the policy drivers that really helped to empower nurses to be involved in research? I think it's important to say that the government and NHS, the NHS in the UK is our public health provider. So it's the National Health Service. So we all pay money from our taxes that pays for the National Health Service. So when we go to the hospital, we do not pay anything. So we all love the NHS because it's such an important part of British identity, this free to access healthcare. The government and NHS level policies have catalysed the shift by recognising nurses as potential research leaders. And I'm sure it's the same here. You'll have a chief nursing officer in Indonesia and the CNO, the chief nursing officer in England, Wales, Northern Ireland and Scotland have been really instrumental in this. But in 1991, the NHS Research and Development Strategy was a really important document in the development of nurse research. Then in 1997, the Research Governance Framework. And as I say, the chief nursing officers have really been so instrumental in promoting nursing research, not least in the document of Making a Difference. This is actually the uniform that the student nurses wear in Scotland. This is the one for GCU, so you can see GCU on the uniform. But as I said, all the nurses in Scotland wear the same uniform. So if you go from one hospital to another, you'll recognise someone as being a staff nurse, you'll recognise someone as being a student nurse. This is the national uniform for student nurses in Scotland. But key to the development of research in the UK is obviously related to education and capacity building. And that's through creating research literate nurses through higher education, paved the way for more structured career pathways and academic credibility. And I think the research programs that have been housed within the universities have also been really important in that. The university, like GCU, there was a big push in the 1990s for colleges to become universities, and GCU was one of these who became a university in the 1990s. And lots of these universities housed nursing programs. I should say, I meant to say earlier on, in terms of the undergraduate programs at GCU, we have about 650 student nurses per year. So in each of the 4 years, we have around 650 student nurses. I'm not sure how that relates to the program here, but perhaps you can tell me after this. I should say, if you have any questions as we go along, please just raise your hand. So also the master's level and PhD routes have expanded greatly in the UK, and the National Institute for Health and Care Research has been really seminal in developing resources and supporting nursing research careers. As I say, the Chief Scientist Office in Scotland have all developed career tracks to enhance the prominence of leadership roles within clinical research. So the NIHR that I mentioned in the last slide has transformed opportunities by funding nurse-led studies, building infrastructure, and making nurses principal investigators on national projects. The programs that are listed here aim to develop clinical academic research leaders of the future with the potential to become independent researchers and to become principal investigators to lead their own research projects. The aims of the programs are really to fund topics and research methodologies that increase the effectiveness of NHS services and provide value, money, and benefit for patients. And the NIHR is an NIHR is a really important body within the UK to support nurse-led research. So this photograph here on the right is one of the beautiful islands in Scotland. This is actually Skye, and it might look like one of the scenes from Harry Potter, but it's telling that the landscape in Scotland is very beautiful, as is Indonesia. Unfortunately, the mountains here seem to be in clouds lots of the time. But if you do have the opportunity to come to Scotland, please do. It's a very, very beautiful country and we're very friendly people as well. So in Scotland, the Chief Scientist Office supports nursing and midwifery and allied health professional research, and NHS Scotland support roles as well. There's lots of emphasis on clinical academic fellowship schemes and very strong linkages between the NHS and universities. And really, Scotland has championed the nurse researcher through dedicated funding streams, networks, and recognition of the clinical academic role. So this would be nurses who are working in the clinical area who would like to be involved in research and have linkages with the universities. So it helps to support research that is really patient-focused, which is really, really important. Some key milestones in the UK have been the formation of the RC, the Royal College of Nursing Research Society in 1986. And as I've said, I'm very proud to be a member of the steering committee of the RCN Research Society. We hold an international conference every year in the UK. This year it's in Exeter in the south of England, but I'm very proud to say that I'll be hosting next year's conference in Glasgow next September. So if you're working on any research projects or you would like to attend the conference, please do, and we can say hello again when you come there. The NIH Nursing Research Strategy in 2021 was a very important document in terms of supporting nurse-led research. And I think the growth in the number of nursing journals from the 1980s onwards was also a real focus for helping to publish research studies led by nurses, and was hugely important. So one of the other developments has been in broadening the scope of research have been to engage with undergraduate nursing students. An example of this that we've been involved in Scotland has been placements or practicums in clinical research environments. As Tita said, one of my jobs before I moved to the university sector was to help to set up a clinical research facility in Edinburgh. So this is essentially like a research ward where it's a centralised unit for research to be conducted. And we have about 3 of these in Scotland, and some of our student nurses go to these units for clinical placements. And it's really been hugely successful for nurses to help to encourage them to consider research as a career. In Scotland, there's real partnerships between the research facilities and the universities, and they've invested a huge amount of time to make sure that the students feel welcomed and they have good learning opportunities. And this is alongside, you can see some of the publications in this area. Two of the students that I have been responsible for at Glasgow have been Tammy Rose on the left here and Natalie Elliott. Tammy had a placement in the clinical research facility during the COVID pandemic, and she was actually her experience. She disseminated information about her experience, and she was shortlisted for a UK-wide Student Nurse of the Year award. And Natalie, do you know the BBC, the news company and broadcaster from the UK? She participated in a BBC news item, has written a blog for the Council of Deans in the UK, and has gone on to have a career that's involved research. And if possible, I would like to show you a YouTube clip of the link down at the bottom there, yeah, from Tammy. While that's loading, does anyone have any questions so far?
Anyone if have questions, just raise up your hand.
It can be quite difficult to put your hand up in a big room, can't it?
No one yet? Okay. Maybe Nick.
Yeah. Hello to everyone that's online.
Dr. Gordon, we have one question. It's okay.
Oh, yeah.
Okay. While we're waiting the video and also the question from the students, may I have some question, Dr. Hill? So my name is Iqbal. I'm faculty member here. And I think we met you last time in the UK in Northampton University, and there's an RCN conference. Did you attend the conference? Am I right?
Yeah.
Yes. So that's why I think I saw you on that conference.
Oh, did you?
Yeah,
Oh,
two of us, me and
okay.
two other colleges went there in last year in September
In Newcastle or in Manchester?
in Northumbria University, Northumbria.
Where was
Hi, I'm Tammy. I am now.
Oh yeah, yeah, Northumbria University.
Okay, Northumbria.
Yes, at
yes,
Newcastle.
Yes,
Yeah.
okay.
Yeah.
That's a
I just have one question, Dr. Hill.
Yeah.
Related with the research, because I saw it in the website, there's a research center. So is it possible, like, if we can have research collaboration? And of course, when we have this collaboration, like, for example, we have some research team from here and also research team from your university, and we can work together afterward, and we can have this kind of study comparison between the university and two countries, and of course at the end we'll publish it together. And this is the first. And the second is about the conference, about the RCN, because I just talked with my colleagues that you are the boss of the RCN. Am I right?
I'll be the scientific. I'll be
Committee, yes.
I'll be the chair of the scientific
For
committee
sure.
for Glasgow. Yeah.
Yes, I know. So is it possible, like, if the RCN have a provide some particular like grant for the Asian people or Asian or like us Asian
Okay.
people who want to go to UK to attend the conference, like we have some kind of this like in the IAS. International AIDS Society Conference. Every year they always conduct a conference, annual conference, together with the funding as well for the scholarship. Of course, there's selection for get the scholarship. So my question is it possible in the future, like RCN can provide some scheme of like this, so we can get the we can compete each other, and then we can attend the conference using the scholarship. Thank you.
Thank you very much. Your first question about collaboration with the research units, absolutely. I think I think research ever more than ever is an international collaboration now, and I think if there are any of the areas that you see on the slide there, if you're conducting research in any of those areas, then I'm more than happy to put you in touch with the leads for those groups in Glasgow. and hopefully we could collaborate. In terms of funding, it's a long-lived problem about funding for conferences. Actually, this year, the NIHR that I mentioned, they're funding, I think it's at 43 places at the conference. So I don't think the RCN would be in a position to fund all the funding, but certainly there may be free places for the conference because the conference fees are quite expensive as well. So it might be that there's the students from UNPAD could apply for the fee waiver for the conference, or the staff could apply for the fee waiver. So that would save, you know, £500 or however much the fees are. Yeah. But I think that's something we're keen to expand moving forward. Okay, thank you very much. So this is Tammy, and Tammy, what happens with the research placements is we try to get some of the nurses, student nurses, who are interested in research, but Tammy was actually someone who hadn't ever thought about research. There's subtitles, I'm not sure if you can see those, but the automated system for subtitles doesn't always pick up the Scottish accent very well, but hopefully you'll be able to see those at the bottom. I'll move so you can see. Thank you.
A qualified nurse. At the time of my clinical research placement, I was a second year. I loved my time in clinical research. But prior to actually going there, when I got my email telling me about the placement, where it was, I was like, oh goodness, is this going to be 10 weeks of reading on a computer screen? Is there any patient interaction? I really had no idea what I was in for. Once I got there, things they picked up. It was very busy because we were doing the COVID vaccine trials. So that was really cool. I really enjoyed that. We had surgeons coming in, we had taxi drivers, we had everyone was coming in. What I loved was speaking to people and saying, why is it you wanted to be part of this? Were you scared? Were you excited? Most people's response was, I want to give back to the NHS. I want to play my part. This whole pandemic is kind of out of my hands, and if this is something I can help, this is something that can push things forward, then I want to be part of it. So I thought that was really kind, and it was amazing to listen to, actually. And such a mix of different people from different backgrounds, different careers. It just shows, again, that we were all in this together. I managed to get all my clinical skills ticked off, which I wasn't sure I would be able to because I wasn't in like a typical ward setting, but I managed to achieve that no problem. I also gained skills that I wouldn't have got the opportunity to do anywhere else. For example, working in the lab. I was spinning bloods, I was doing loads of cool stuff. I felt like a scientist. My role within the vaccine trial was to be in the 15-minute area for post-vaccine or placebo. So I had to take these patients' observations. I was chatting to them, making sure they were feeling okay, if they had any questions. I offered them water and a lovely NHS biscuit. I just enjoyed hearing about them, and they all got chatting as well, which was really nice. I learned a lot of skills that I will definitely carry on to future jobs. I got very familiar with the arrest trolley. I learned lots about the anaphylaxis medication. Obviously working with a brand new vaccine, this was really important to know a lot about. Tomorrow, actually, I start my job as a Band 5 nurse in a respiratory ward. So I'm really looking forward into working out what research goes on in things, and I am hoping to do some more research in the future. If I could pass on any information to students that would have a clinical research placement, I would say go for it, enjoy, go in with an open mind, and if you have any questions, ask. But it's a once in a lifetime opportunity, and I feel really blessed that I actually got to go. Thank you.
So Tammy was someone who really wasn't sure what a placement, a clinical placement in research would be like, but you can see that she had a fabulous time. And I think I'm not sure about here in Indonesia, but sometimes our undergraduate nurses see research as something that's abstract. It doesn't always apply to their clinical practice. So one thing that we're really keen to do is to try to encourage student nurses to think about how research is real, how it impacts patient care, how it impacts on their careers, and how some nurses could have a career in research, or at least use research in their everyday practice. So we were really pleased that Tammy and Natalie and other colleagues at GCU were able to go there. One of the other things that we're involved in, this is something that was funded by the UK National Institute for Health and Care Research, the NIHR, and was developed by the Royal College of Nursing and King's College in London. And these modules, these short CPD courses, were launched last year and are accessible to all health and social care staff, and can enhance knowledge and understanding of research, as well as introduce different careers in research. I checked, and these are actually internationally accessible. So for yourselves or for any nurses working in the clinical area, I've included a QR code here. You need to register, but that's free, and then you can access all the NIHR modules there. And we're really pleased with how these have turned out, and I think they've been very successful. So please do access those and encourage others to do so as well. I'm more than happy. I think the IT chaps over here have this presentation, so I'm more than happy for this to be shared afterwards. So how about Europe? Well, Europe has a diverse landscape in terms of research. Some countries are very well ahead in supporting nurse-led research through academic infrastructure and EU-funded projects, but others have still got a bit to go. So countries like Norway, the Netherlands, Spain are really well developed. But there are others, especially in Eastern Europe, so Romania, Hungary, those kind of countries have more work to do. The European Union, via Horizon 2020 and Horizon Europe, supports research in the European Union, although you may know that the UK sadly left the EU a number of years ago. This is something that Scotland, where I'm from, we didn't want. In the referendum, we voted to stay in the EU, but unfortunately there was Brexit, so the UK left the EU. So unfortunately, we are not able to access these funds. But there has been a rise in advanced nursing roles across Europe, although there are lots still to do. So just as an example, the Nordic countries, so that would be Norway, Sweden, Denmark, and Finland, they've invested very heavily in nurse-led research and have had real success in clinical nurse specialist reading funded trials. And digital innovation, especially in Finland, is huge, and nurses have really been at the forefront of this. So Nordic countries have a strong university healthcare link and support research that focuses on prevention and technology-enabled care. In Europe, there's a real emphasis on cross-border collaboration and networks. So pan-European collaboration is growing, and these networks support early career researchers and multinational studies. And these are some of the bodies that help to facilitate that. Cost collaborations that are there, that's European cooperation in science and technology. And I'm actually part of a bid to establish a network of nurse researchers around Europe. So if we're successful in that, we would get €600,000 over 4 years to help to support nurse research. So what are the lessons from Europe? They've had a long-term investment in academic nursing. Their research is integrated into workforce planning. And I think because they work together within the European Union, they have very much of a joined-up approach. They have strategic use of European Union and institutional funding. So I think we can all learn from Europe and how they've had sustained investment, better integration, and a wider scope of research priorities. So what are some of the enablers and support structures that help with research? Where nurse-led research thrives, there are strong enablers like mentorship, leadership buy-in, and integrated roles. And I think that's manifested itself in academic mentorship and networks. I mean, if you are interested in research, hopefully you'll be able to get a mentor that will be able to help you and advise you about how to shape your career, which can be really, really useful. Support from clinical leadership. If you have a charge nurse in the area you're working in, and you hopefully have support from them. Utilizing networks in Indonesia and overseas, and working with other colleagues as well. Unfortunately, there's also barriers, and of course, the biggest one is time and the amount of work that I think we're all busier than ever now. So finding the time to be involved in research can be quite difficult. Funding is also very difficult to come by, and it can help to buy out time if you do have funding. Cultural barriers in some clinical settings, I think that relates to when sometimes not everyone has a positive attitude to research. So I think if that is the case, it can make conducting research in that area more difficult. And there's still is limited research leadership roles, which can mean that there's a lack of positive role models. So despite progress, structural challenges persist. Nurses often lack protected time or institutional support to pursue research. So unfortunately, there are still some barriers. One of the really big things in the UK now is patient and public involvement. So this is shortened to PPI. PPI in the UK is no longer optional, as it strengthens research quality and ensures that the findings and results align with real patient needs. So that's involved in co-designing research questions with patients, and inclusive participation models for recruitment. It helps to enhance relevance and uptake, and it really helps to make research more relevant to the people who it matters most to. And then, of course, impact. And impact isn't only clinical. Nurse-led research boosts professional confidence and fosters a culture of inquiry within the nursing profession. But impact helps to demonstrate improved care quality and outcomes. It can increase staff engagement with research, and the impact can also be on new career pathways for nurse researchers. So these are my own thoughts about possible future directions for nurse-led research. I think there's a big movement away from hospital-based care to care in people's own homes. So research in community and mental health settings, I think, will be big areas of development. I think about embedding research into every nursing role, I think is really important. Enhancing research in undergraduate education. And for all these things, I think international collaboration is key. And one of the things I hope from today is that we'll be able to collaborate more closely with UNPAD moving to the future. So finally, as the 2025 International Nurses Day theme shifts focus to health and well-being of nurses, this theme underscores the critical role of a healthy nursing workforce plays in strengthening economies, improving health systems, and ensuring better outcomes for communities worldwide. So I'd say let's keep growing research and investing in nursing and help to improve nursing in the future. So thank you very much, and be delighted to take any more questions.
Okay, thank you very much for valuable information that already provided. And now is our opportunity to have question answer. Anyone have questions? You can ask in Indonesian. Miss Hannah will translate for you. Please, if anyone have question in Indonesia, it will be fine. Yeah, okay. Good.
Thank you very much.
So, okay, I have a questions about research. So, because I was when I was an intern working as a research assistant on a project using a mobile tech to monitor fetal health and also heart rates of mother. So I saw how healthcare workers at community clinics were so overwhelmed by having to use so many different applications and systems that didn't connect with each other. So it made me wonder if data science for a common good, as I scroll down to the Glasgow University's website, that kind of research topic, data science for common good. So it is really about participations and social impact, right? And my question is, how can data science can be used to build system and that more integrated, practical, and also sustainable for real-world healthcare settings? Okay, that's my questions. Thank you.
Thank you.
Okay, thank you very much.
Thank you.
Dr. Gordon, you can.
Thank you. So, sorry, could you just repeat the question again? I beg your pardon, just at the end there. Thank you. There was 3 bits to it, I think.
Okay, my question is like, how can data science be used to build systems that are more integrated, practical, and sustainable for real-world healthcare and settings?
Thank you. Yes, it's a really important question. Thank you very much.
Thank you.
And for me, the big thing is collaboration. I think research, I think in the past, research done by some nurses was done in isolation, and it really wasn't integrated into what the patients need. And also with the healthcare systems. So I think that the structures in which research are conducted in are all interrelated. So really collaboration between all the stakeholders is so important, because I think without that, then the research really doesn't have any impact, doesn't really have any meaning. The other thing is about dissemination, because I think there's so much research, the findings of so much research aren't disseminated, and there's no point in having research if nobody knows about it. So it's actually about finding ways, and I think that's one of the things. I know that publications can be very difficult, but it's one of the great things about social media now, that there's loads of different ways of how you can disseminate your findings from your research on LinkedIn, on Instagram, or via webinars, via blogs. So I think about people working together is key, and then actually getting the message out there. Even if your results or findings are a bit disappointing, aren't what you hoped for, it's very important that people know that. But hopefully you have really impactful research that is really meaningful for the people that it relates to. So I think collaboration is key, and dissemination. Okay, thank you.
Did that answer your question or any other thing? No. How about the data sciences? Data science. You asked like data science, right? She also asked about how the data science can be applied in research and facilitate connecting that collaboration thing.
Yeah, I think it's not my particular area of expertise, I have to say, but I think there's so much big data around now, and I think that's something that's a really useful tool for nursing research, because it's probably something that's been underutilized. So I think nurses, it's really incumbent on nurses and educational providers to make sure that nurses are comfortable with using data to enhance their research. So I would say using big data, and again linking that to patient outcomes.
Okay, thank you very much. Any other student have questions, or everyone here has another questions? Raise up your hand, please. Or the audience from Zoom. Anyone in the Zoom have questions? You can directly open your mic and deliver your questions.
My email address is on the screen here, so if anyone would like to ask a question or contact me, then please feel free, and most of my Instagram account is on there as well.
Oh, okay. Make sure that you record already the Instagram if you have any question, because Dr. Gordon also work for like international student support, right?
Work for
International student support something in
yeah,
ECU. So if some of you interested to join with Glasgow, right?
Yeah,
you can ask further about the information, how get the scholarship, something, how apply the scholarships, and so on.
Yeah.
Anyone?
we would be delighted if any of you would like to come and study a master's in nursing or a doctorate in nursing at GCU.
Yeah, for sure, for sure. Anyone, please? Okay, thank you.
Okay. As sixth semester undergraduate student, we began to be directed to conduct research. And myself was interested in using the large administrative data from Jaminan Kesehatan Nasional as an insurance that covers 98% of total Indonesian populations for clinical research related to health facility utilizations. However, I had some difficulty, more precisely, like concern in utilizing this data to make it relevant to nursing practice. According to your profile, as I know, you have conducted research on decentralizations, clinical trials, and developing clinical research practice that make innovative use of health data in Europe. From your experience, how can European best practice in managing and utilizing large-scale health data be applied to support nursing research based on large administrative data such Jaminan Kesehatan Nasional in Indonesia?
Sorry again. The question I didn't quite hear at the end there. I beg your pardon.
From your experience, how can European best practice in managing and utilizing large-scale health data be applied to support in nursing research based on large administrative data such Indonesian coverage?
Yeah, she would like you to share in the European context because she actually previously joined like research assistant and got like big data from universal coverage, national universal coverage data. So how to use this data to support like nursing research? Because that data is like very general in terms of the health issue, something, but how to use this data to support the specific nursing research.
Yeah, and I think it's in my own experience. Thank you very much for that question. In my own experience, I think the scope of what is thought of as nurse-led research has changed dramatically from when I first started to be involved in research. I think traditionally nurse-led research was often viewed to be qualitative studies and small studies on patient experience. But I think there's much more maturity within the nursing profession now. And I think that's why I think it's subtle, but there is a change. There is a difference between nursing research and nurse-led research, because nursing research kind of infers it's specifically to do with nursing practice, whereas nurse-led research, I think, could be involving using data to do large-scale quantitative studies on patient populations and to look at health outcomes. And it really can have an impact on general healthcare and not just on nursing practice specifically. And I think that, for me, reflects the maturity of the nursing profession moving forward. That I think the scope of nurse-led research is endless. It can be whatever you would like it to be. And I think if you're able to use that huge amount of data from 98% of the Indonesian population, I think you said, that's a fantastic resource to be able to tap into the big data that I was mentioning before. In Scotland, we have electronic records for every person in Scotland. It's only 5 million people, but they're really detailed health records. And nurses are accessing this information securely to be able to help to improve patient outcomes across the whole of Scotland. So I think it's really important that nurses see research in its fullest extent, not just in terms of qualitative research, but using data that you have access to help to improve patients' lives. Okay, thank you.
Okay, thank you very much, Dr. Gordon. And we still have 5 minutes left. If one here any questions from Zoom? The participant from Zoom, any questions?
Not yet.
Thank you very much. I'm Hartia Harun. I'm a lecturer here in the Faculty of Nursing.
Thank you.
I'm interested in improving collaboration or integration of clinical research
Yeah.
between hospital and the universities.
Yeah.
Because I saw from the your presentation, it is so beautiful, the integration. There is no limit or barrier or not. I mean the limitation between nursing research, which is taken place in the hospital or community, for example, and the clinical research. Those clinical research are conducted collaboratively between the lecturer or the researchers in the community who has the capacity and also the knowledge about how to conduct good research within the in the clinical area. So how to improve? Because in Indonesia we are quite different. We have difficulties to conduct research, clinical research in the hospital especially, but in the community we are quite better, easier than the hospital. But from your experience, how to initiate or how to improve that collaboration between two organizations, because we're different. Yeah, thank you.
Thank you for that. It's a really good question, and I think it's a bit of an ongoing problem, because I think you, on the one hand, you have the hospital where you have the clinical nurses who have the practical based questions, but perhaps not the infrastructure to be able to support research. Then you have the universities that perhaps have the infrastructure to support research, but don't have access to the clinically based questions. And I think there's different ways of doing that. And Dr. Hannah's supervisor at Glasgow University, Professor Bridget Johnson, she has a joint role between the University of Glasgow and Greater Glasgow and Clyde NHS, the hospitals. So I think having someone who kind of bridges both organizations can help to facilitate collaboration and encourage the clinical staff to embrace research. Because as I say, I'm sure that it's the same in Indonesia, where the clinical nurses are very, very busy and don't have much time, but they may be keen to be involved. And it's about finding ways, mainly through personal connections. I think it's about relationships. It's about having key people like Bridget, or in where I'm from in Edinburgh, there's Professor Juliet MacArthur, who has a similar role based in the NHS and based in the universities, who can bridge that gap. And I think that's a key way to do it, because without those people able to support the developments, it's just not going to happen. The other way, unfortunately, or not fortunately, but can be if the government says you have to do this. You know, so if it comes from top down, then that can mean that it can be encouraged. But for me, the best way is for personal relationships, personal experience. But it's a really good point. Thank you.
Okay, thank you very much. And the last one question is okay. Okay, I'm as a lecturer actually at the coordinator for research in nursing course, and one of the challenge is how to make our students love research, because it's sometimes research is to be like allergenic word, right? So how to make our student like loving research work? Thank you very much.
Without your lecturers looking, could I ask for you to put up your hand if you love research?
No one. Anyone love research? No one? No, I said this one.
You know, if I asked the same question in Scotland, I think sadly I would get the same result.
Really?
Yeah. Well, I think that there are some people who are really positive about research, and other people. I think when you're in high school and you think about going to be a nurse, you think about going into the hospital, you think about caring for people in the community. You don't necessarily think about research and evidence-based practice. However, there's so much that you know. I worked as a clinical nurse in the 1980s, and as a consequence, my back is terrible because there wasn't an evidence-based approach to moving patients around a bed. You know, every 6 months, I'll be tying my shoelaces and my back will go. And that's because there wasn't a proper evidence base for moving and handling patients around the bed. So I think as a university, that's part of the reason why I'm keen to do the podcast research. What we want to do is to think about ways to help encourage students to see research as being real, being important, and being something that they could potentially have a career in. When I was in your position as an undergraduate, if you were to say to me that you were going to have a career in research, I'd say, okay, I'm quite interested in research, but I wouldn't understand where to go. So I think it's about showing how research is real life. Research is nursing, and research is part of what everyone should do. Even if you're just research aware, then that's good enough, because you need to be aware of the research to provide the best care for your patients. Otherwise, you're at risk of not providing the best care for your patients. So I think we still have a way to go all over the world, but I think we need to think of different ways about, I mean, we show our students that video from Tammy to show how enthusiastic she was from not being sure about the research placement to being really enthusiastic and feeling like a scientist. So we just need to use, as academics, we need to use different ways to help to engage with students and make sure that they come with an open mind. And I think students shouldn't listen to their colleagues because they'll say, oh, research, I don't really like that. But no, research is exciting, research is fun, and it's really important.
Okay. Thank you very much for your motivation and valuable information. And we come to the end of this session. And thank you very much for everyone who contribute to this session, particularly Dr. Gordon, who already provide us valuable information. Hopefully, this session can broaden your perspective related to the research work. Even though today you just laughing when you hear research, hopefully someday you will really love about research ones. Okay. And now we come to the last session. Is ready already?
Terima kasih, everyone.
Oh, thank you very much. And the last session is we are giving the certificate of appreciation for your session today, and will be given by Mr. Iqbal as the manager of the collaborative. Come.
It looks like it was a surprise to him.
Okay. Wow. So Dr. He, would you mind first stepping down here? Okay, Dr. Hill. So, on behalf of the Dean of the Faculty of Nursing, please let me give the certificate to you as our appreciation to give a wonderful speech this morning which is very important and beneficial to our students, especially for brighten their research mindset. So we hope that at the end, our student can have a good perspective in the research and also a good motivation to the research. Thank you so much. Thank you. Thank you so much. Please give this our certificate. Yeah. Okay, let's take a picture. We over here. Yep. Yeah. Thank you.
Okay, thank you very much, everyone. So is the end of our session today. Thank you very much for every contribution that you already given to this session. Thank you. Assalamualaikum warahmatullahi wabarakatuh. See you in the next session.